I'm going to say not yet. That's where we're
Repeat
working.
the question.
Oh, yes. The question is, are there diagnostic imaging for psychiatric illnesses? And not yet. I'm going to say no, not yet. We're getting there. But typically, if someone presents with a very difficult situation and you're not sure what an underlying illness is, maybe they're showing different illnesses and you're trying to sort things out, you might give them like a brain scan to try to narrow down, try to get some information. But those are few and far between. In like neurology, for example, stroke and whatnot, neurological illnesses are much, much more common, and that's better established. But for psychiatric illnesses, we're still trying to map out individual differences.
Let me just add on to that. If you look at our diagnostic criteria in psychiatry, nowhere in our diagnostic criteria does it reference the brain or biologic functioning. So it wouldn't make any sense to me a priori to think that any of these diagnostic schemes that are in DSM-3, DSM-4 now, are soon to be DSM-5, no way in the world would I expect there to be a biologic finding diagnostic of that collection of behaviors. Because it's just like driving from here to Dallas. There's lots of ways to get to Dallas. You don't have to go down the interstate. You can take all kinds of cutoffs and do all kinds of things. Same thing with behavior. There's a lot of things that can affect behavior. Be similar to us trying to diagnose. We're at the state where internal medicine and pulmonology, in the lungs, we'd be trying to diagnose the bacterial etiology based on the way the person coughed. Not a good way to do that. There's better ways to do that. What I think is going to happen in the next few years, the NIH has what do you call it? Not a protocol, but a initiative where they're actually moving away from DSM criteria, the insurance criteria, for purposes of research. And that's because we now have biomarkers that we know mean something about the treatment response or the severity or the rapidity of decline. We now have those biomarkers, but they're not present in everybody. So I think that's the direction we're going to go, is we're going to say, oh, you've got a depression that's associated with the short allele on the SLC6A4 gene. And then that will mean something to me, because I'm going to say, you can push Prozac in him all day long and he isn't going to respond.
And actually, to add to that, there is a new initiative at the National Institute of Mental Health to redefine or reclassify mental illnesses in terms of their observable biological or behavioral traits and corresponding biological traits. So there's many disorders or symptoms like impulsivity, which span multiple disorders. So it's an attempt to try to deconstruct the brain or the person, the disorder, into observable deficits, and then find biomarkers or behavioral or biological evidence supporting those different deficits. I think it would be more predictive, not necessarily mental illness, but of treatment outcomes and what treatment might be ideal for a given patient. I guess you could be a predictive aspect of that. You have a person and try to predict down the road what they may develop, but I think it'll be more useful to predict an optimal treatment regimen.
Yes.